here has to do with BlueCross BlueShield of Texas and CHRISTUS Health, and just really any CHRISTUS Health hospitals, ambulatory surgery centers, and physician clinics here in the state. Well, we have some information on this. It says that they have accepted BlueCross BlueShield Texas, also known as BCBSTX insurance, for decades and were fully intended to continue. However, if they cannot reach an agreement by July 1st, the BCBSTX customers will no longer have in-network insurance coverage at CHRISTUS Health Texas locations. Now, there's a lot of information in this, so you all, if this has something to do with you, you may want to pay attention, because there's also some solutions or potential ways that you all can find out more information towards or throughout this article. So it says the healthcare provider stated they have been negotiating with BCBSTX for months to secure a reasonable insurance reimbursement rate for health services. BCBSTX responses have been unfavorable thus far. However, they will continue to communicate with them in hopes of finalizing an agreement. Now, CHRISTUS Health says they are working hard to keep healthcare costs affordable for all while continuing to provide high quality and compassionate services to patients and their families. The provider encouraged patients to call BCBSTX customers service number located on their insurance card to let them know how important it is for CHRISTUS Health hospitals, ambulatory surgery centers, and physician clinics to remain in network so that they have access to the entire provider network and benefits as a member, as a BlueCross BlueShield of Texas member. Now, their emergency departments will always be available even if they go out of network with BlueCross BlueShield on July 1st, but they will do all that they can to ensure that patients get the affordable quality care that they need and deserve. Now, in a recent communication issued by BlueCross BlueShield of Texas, the company indicated that CHRISTUS Health may not submit patient insurance claims to BlueCross BlueShield after June 30th. Now, according to CHRISTUS Health, should that happen, they will be able to file in-network claims to BlueCross BlueShield on the patient's behalf. They will be unable, to file in-network claims to BlueCross BlueShield on the patient's behalf, but they will be able to file out-of-network insurance claims if the individual plan has that option. Now, BlueCross BlueShield of Texas may communicate that there are other providers willing to accept Texas BlueCross BlueShield members should the healthcare provider go out of network. CHRISTUS Health states that this may not be true, but the reality is that access to many of those providers will be limited due to capacity issues these providers are already experiencing. In other words, those providers will not be able to handle the additional volume of patients, and in turn, patients and dependents will have long wait times or may have to seek care outside of their immediate geographic region. Now, CHRISTUS Health wrapped up the extensive release by saying that they are truly honored to serve patients and thank communities for putting trust in them. Now, like I said at the beginning of this, there is a way that if you are affected by this to possibly find out more information or state your concerns. So it says for those looking for more information, continue to check the CHRISTUS Health website for updates, as well as checking the FAQ section on their website. And then for additional questions that were not addressed in the FAQ section, customers can contact the customer service department at 800-422-0490. Again, that's 800-422-0490 for the customer service department. So if anybody's experiencing that, go ahead. You all can contact that number for further information and to kind of learn more about what all is going on between CHRISTUS Health CHRISTUS Health locations in Texas and BlueCross BlueShield of Texas.